So what is a Kegel? A Kegel is an exercise that is often described and used to help strengthen and create a contraction through the pelvic floor muscular sling. Itself is not just isolated around the vaginal opening, but it is actually the entire connection and contraction of the entire pelvic floor from the rectum all the way to the front where the vaginal opening and the urethral opening exist. So oftentimes the first mythbuster I debunk for people and my patients is to understand that your Kegel is not just isolated in the one spot around the vaginal opening, but rather through the entire bottom half of your pelvis. So I want you to think of this entire sling participating in the Kegel, not just having one section participating. So when I describe a Kegel, I describe it as something of starting back kind of at the rectal opening or the anus, and at that point thinking of trying to lift up and in from the rectum all the way towards the front of the pelvis, as if you're trying to draw up and into that pubic symphysis region in the front of the pelvis. So that entire connection is being drawn up and in with our Kegel, and then we also need a full relaxation phase from the front all the way to the back in order to for that contraction. So starting at the back, moving all the way to the front to lift up and in, and then slowly releasing with control to let that tension out. So the contraction phase is just as important as the relaxation phase of this dynamic system. While we're often concerned and thinking about the contraction phase, there are cases and situations where people are good at the contraction, but they're not good at learning how to relax and also create other challenges and dysfunction within the pelvic floor system that can contribute to leaking and pelvic pain in general. So with that idea too, this connection that we're generating also needs to be paired with our breath in order to achieve an optimal connection with the pelvic floor and reintegrating it into our brain and the nervous system to understand how to regulate this particular connection within the bigger system of our body. So the inhale phase is paired with the relaxation phase of the pelvic floor, and inversely the exhale phase is paired with the contraction and the lift of the pelvic floor. So back to that conversation of the diaphragm and the pelvic floor being a system, the diaphragm and the pelvic floor contract and relax together and act as a piston to help maintain and monitor that intra-abdominal pressure system. So as we inhale, I instruct my patients to take in a breath, that diaphragm lowers, and reflexively the pelvic floor also has to lower in order to adjust for that increase in pressure within the system. And then as we exhale, that pelvic floor will also contract as the air is being expelled, that diaphragm is lifting, and that creates a dynamic lift of the pelvic floor simultaneously. So if we have a healthy pelvic floor operating within that larger system, that's naturally occurring without us having to think about it. However, if we have an issue within this system, or we have a pressure issue, or often this reflex is naturally disrupted during pregnancy and needs to be rehabilitated during postpartum periods, that system then kind of needs to be re-engineered from a conscious standpoint, and that's where I educate my patients on consciously pairing their breath with the activation of their Kegel. And then with practice, that starts to become more natural and more subconscious, and then eventually is not something that you have to consciously think about, but that gets reflexively reintegrated back into the body.